Hello, everyone. I am Priya Ramaiah. I am a OBGYN, and I've been in the Canton area for almost 3 decades, if you count my time at Altman doing my residency. I'm really excited to be here today to basically talk to you about incontinence. And as Julie mentioned, if you have any questions that have not been answered by my talk, please feel free to write them down and pass them along to Julie, and I'll be happy. I'll save some time at the end to answer your questions. So welcome to everyone. And it's really, I'm grateful that you took the time to come in here to spend some time with me instead of being out where the sun, I can see the sun shining out through my window. And it just makes me happy that spring is around the corner. That's all I have to say. So let's get started. Let's talk about incontinence. It is an open secret where it is so much more prevalent than one assumes, and you think, you know what, oh my gosh, this is so embarrassing, this is so distressing, I'm not going to talk about it. But basically everyone pretty much, it's so prevalent, so common that we don't realize how common it is. It's an uncomfortable word, and basically it's a whole spectrum of any kind of leakage. We are going to be primarily talking about urine leakage, but there is also fecal leakage. Fortunately, it's not that common, but it's still a problem. So urinary leakage can be anything from a little leak when you cough and sneeze, or if you have a really full bladder, you're going to have some degree of leakage if the bladder is super full and you have to really go pee. It's just a function of how long you can hold it. But as time goes on, the other end of the spectrum, things get worse where you feel like you have to go to the bathroom frequently, even if your bladder is not completely full, where the bladder muscles become more irritable, if you will. It's called irritable bladder or overactive bladder. Normally, the muscles of the bladder stay relaxed until such time that you think it's reasonable to go to the restroom to be able to empty the bladder. And that's when the bladder muscles normally should contract and squeeze out the urine therein. But sometimes the bladder muscles become more irritable, and we'll talk a little bit about that. And then one feels like one has to constantly go back to the bathroom. There's a frequent urge to urinate. Sometimes there is a good bit of urine. Oftentimes there is not that much urine. Along with this, there is also the issue of awakening at night. Normally, one can awaken 1 or 2 times at night, and typically it's not that big a problem, but it becomes an issue when we have to get up 3, 4, 5, 6 times a night. And then it does impact on our sleep quality, affecting our quality of life during the daytime. For some, it's something they simply refuse to admit that they have, and to each their own. And I think this is such a personal issue that I think one has to figure out, what is my level of tolerance? How much am I able to take? It's not that the first time you have a little bit of a leak that you go running to the doctor, say, hey, give me some medication or something. But I think everyone has to kind of figure out for themselves, when is it a non-issue and when is it a significant issue? Some may say, oh, I just pee a little when I laugh, or sure, I have a few bladder leaks, but it's just because I'm getting older. But what they're describing isn't just the way of life. What they're describing is incontinence, and it's anything but normal. If you're experiencing symptoms like these, it means that there is something that's not quite right. So just the facts. Up to 23% of women take time off work because of their incontinence. I am primarily talking about women because I am a gynecologist, but a lot of these treatment options are applicable to both men and women. Women with severe incontinence pay upwards of $900 annually for their routine care and products. According to the National Association for Continence, 54% of women with undiagnosed incontinence report loss of confidence, and also up to 45% a loss of intimacy. So it's not just the effect on the lifestyle in terms of the annoyance of having to get up to go to the restroom often or having to use different products. It's also an issue with sexual dysfunction. So up to 50% of women with incontinence also experience sexual dysfunction. And we'll talk a little bit about how this is so intimately related. The other issue that is huge, especially as we get older and we need to be more vigilant about our physical fitness, more than a third of women between the ages of 45 and 50 avoid athletic activities out of fear of incontinence. They used to go jump on the trampoline before. They used to go bike riding. They would, mock wrestle with their kids on the carpet floor in the living room. Well, now it becomes more of an issue. They would jump rope. Now it becomes an issue. You can say it's a normal part of aging, but you don't have to. You can modify your lifestyle and avoid those activities, but you don't have to. You can suffer in silence, but you don't have to. We are not living in the age of our mothers and our grandmothers that we have to suffer in silence. There are many treatment options, and we'll talk about these. And like I said, if you have questions about them that I have not addressed in my talk, I will give some time at the end that you can, you're free to, welcome to ask me your questions. I divided treatment options into 4 broad categories. There's physical therapy and biofeedback. There are medications, which is the mainstay of treatment as it is today. Surgery is an option, and we'll talk about some newer technologies as well. Physical therapy and biofeedback basically involves working with a physical therapist, not your regular physical therapist that you might see after your knee replacement or your hip replacement, but this is a pelvic floor physical therapist who works one-on-one to help improve the pelvic floor muscle strength by, among other things, Kegel exercises and providing electronic feedback, coming up with a home exercise regimen that you can do at home once the therapy with the physical therapist is over. This oftentimes requires ongoing exercising maintenance at home with almost daily at-home exercises. Physical therapy and biofeedback for incontinence is oftentimes covered by insurances. Most plans will cover it, especially the commercial plans, but invariably there is a limit, an annual limit that they restrict you, and they'll cover so many visits a year, etc. And that depends on the individual plans. So in biofeedback, if you look at this picture, and again, I'm restricting these pictures to those of women because that's my area. So if you're looking at this picture, and can you see my arrow here? Okay, so this is a side view cutout of the human body. Right here in the front is the pubic muscle, a pubic bone. So this cream colored structure is a bone. And in the back, you can see the tailbone. So our pelvis basically is this circular bone. And at the bottom, it's open. There's no bone at the bottom. And this space between the pubic bone in the front and the tailbone in the back is bridged by a hammock of interlacing muscles. This is what we call the pelvic floor muscles or the pelvic diaphragm. And it basically, the job of the pelvic diaphragm is to support these organs. These are the most important organs that are being supported by the pelvic floor muscles. And you can see that each of these organs, they pierce through the pelvic floor muscle, and the intertwining lacing of these muscles is what provides us continence, whether it is fecal continence or urine continence. So when this muscle becomes weak, these spaces become wider, and there's not that same degree of control. So that is what happens in incontinence. So in biofeedback, basically this muscle is what is targeted, and the Kegel muscles that our physicians often show us that we are taught in Lamaze classes, it's this muscle that is being targeted. So to provide contractions of those muscles, either manually or with electronic means, this is how we strengthen this is what is strengthened in order to provide that continence. Medications. Medications, like I said, are the primary things most physicians will reach for when you go and talk to your physician about this, because it's just so much simpler, so simple to just give you a pill and say, here, take it and be on your way. And granted, they are quite effective, and we'll talk about some of the different categories. Basically, I divide them into 3 different categories: anticholinergics, anti-muscarinics, and antidepressants. So anticholinergics are the commonest and the most available. They're the most number of medications available in this category. A lot of them, they're generics. And so they bring down the cost of treatment, the cost of the prescription. Most insurance companies will cover at least 1 or 2 generic anticholinergics, and they work very well when they work well. However, there are significant side effects. Some experience it more than others. And the most serious, most significant or debilitating side effect is dryness of mouth, because it does kind of dry you out. And I will tell people, my patients, to try, chewing gum or trying to sip water. There's also some over-the-counter products like biotin that will help cut down the dryness in the mouth. But more ominous that I see as an issue is cognitive issues in terms of declining memory, focus, attention with long-term use. So one of the things I struggle with in my own personal experience is my mother is now in her 80s, and unfortunately she has dementia. But I had her on one of these common anticholinergic medications for almost 15 years. It was working very well for her, and I would keep calling it in for her. I now feel a little, at that time, we didn't have these studies about the cognitive issues. And now I feel a little bit guilty about maybe I hastened that for her. So just something to keep in mind. So I'll also tell people now, if they're taking these medications and it's working well for them, then I will tell them to try to cut down or titrate it down to the fewest number of pills that they can take per week that they still have relief from. Anti-muscarinics work well. This is a newer category. It's been around for the past probably 4 or 5 years. There's no generics in this category, and so the copays are usually higher if the insurances cover it. More and more insurances are covering it, but it works pretty well, especially if people have side effects with anticholinergics or they have other contraindications. Then anti-muscarinics are a good category to go with. Side effects from this: some people will complain of some constipation. Others may complain of an elevation of blood pressure. Well, they won't complain, but as physicians, we have to kind of monitor that and make sure that their blood pressure doesn't go up in this category of medication. And finally, we have antidepressants. They are given in much smaller doses than for depression. They're not usually as effective for severe incontinence, but it's still a good weapon to have in our armamentarium that we can actually use for people that are not able to tolerate the first 2 categories of medications. And again, all of these are available for men as well as women. Surgery. Surgery is a mainstay when one has significant stress incontinence, which is the kind that incontinence that occurs when one is coughing or sneezing. And that's because this area here, the angle between the bladder and the opening of the bladder is affected. It becomes wider. So the surgery for this is not effective for overactive bladder. And oftentimes, even if you do have a combination of stress and overactive bladder, just being on medication or conservative therapy without surgery itself may give you a good quality of life where you don't need surgery. So surgery basically involves anything that can increase this angle, decrease this angle and help ensure continence. And you might have heard of some of the ads from medical legal lawyers about people who have had mesh issues. Well, this is not the same thing, but it's a similar strip of the mesh that is used in here in this area to pull up. So every time one coughs or sneezes, it's kind of like a hammock. It's pulled up, and that increases this angle or decreases this angle and provides continence. This is definitely, in somebody that has pure stress incontinence, it's definitely very, very effective and definitely something to be considered. Newer technologies have been around for the past probably 5 to 10 years. And these are the different broad categories that are available. Posterior tibial nerve stimulation is probably the oldest. I'm not sure if some of you have actually had this treatment. And basically what it is the belief is, the posterior tibial nerve and the bladder have the same nerve root back in the spinal column. And so by stimulating the posterior tibial nerve, one can actually affect the nerve root, and indirectly that helps the bladder. So that's the premise of this. It works reasonably well. It's not very, very effective, but probably I'd say about 30 to 50% effective. It requires multiple sessions per treatment. It does not last as long, and one may have to come back to maintain it probably about every 6 to 8 weeks, up to 10 to 12 weeks, in that range. It's relatively non-invasive, requires multiple sessions. A few insurances will cover it, and especially for those that are not interested in anything more aggressive or who have very low levels or mild incontinence, this may be a good option. Botox injections, this has become more prevalent, especially amongst the elderly, because it involves, because when it works very well. And basically it's going in through the urethra using a telescope type instrument, what's called a cystoscopy, and injecting Botox right by the openings of the bladder into the urethra. And this basically acts like makes it like a functional valve. And so it cuts down on the amount of leakage. This is a little bit more invasive. It's still an in-office procedure. You're not you're not asleep or anything for this procedure, but it does require, to that extent, is a little bit more invasive. They might give you an antibiotic. You may be laid up for that day, etc. But it's still reasonably non-invasive. And then the results are, if they work very well. Unfortunately, injecting Botox is not like a precise science. It's more of a visual, okay, how much am I injecting? How big is the bulge, etc. And so it is a kind of an inexact science. And so when it works really well. Sometimes there may be overcorrection leading to difficulty voiding or even some urinary retention. The other issue is you have to keep going back for it about every 6 months or so. And then it involves the same procedure again. The good news is this is covered by many insurances. Interstim is another one that is, it's a simple mechanism, but it's a little bit more complex of a procedure. Basically, it's the equivalent of a pacemaker for the bladder in very simple terms. It requires multiple procedures in the operating room under general anesthesia. You have to go back in for a temporary pacemaker, and they try to tweak it and see how it's working for you. Once they know it's working well, then they place it in its permanent position in the lower back. That is another anesthetic procedure. And then there's ongoing tweaking of the pacemaker to adjust the signals to be able to provide protection or relief from incontinence. But in people in whom it works really, really well. It requires a high degree of patient involvement, and you have to kind of report back your findings on an ongoing basis to the doctor's office or the company rep, and they help you kind of tweak it to make it work better. Mona Lisa Touch is something that I'm very excited about, especially because I'm a gynecologist. I treat a lot of women that unfortunately have had to deal with breast cancer. And then there are women that have a strong family history that are not interested in using any hormones. And then, women are living into their 80s now. So a third of our lives are spent in menopause. And so we see all the sequelae of lack of estrogen over time. And one of the big issues is tightening or drying out of the vagina and the vulva, and some degree of incontinence. If you see how close the bladder is to the vagina, this procedure, while it's helping treat the vaginal dryness, which we offer in our office, and we've been doing it for the past 2.5, 3 years, and I have to tell you, it is a game changer. I'm so excited about being able to offer some other options besides hormones for my women who are struggling with menopause. The benefit of this in incontinence, and this is primarily for vaginal dryness and vulvar dryness, but I also use it for women who have mild degrees of overactive bladder, because it's so close to the area that we treat that the effects kind of spill over into the bladder as well. As a secondary benefit, you can find relief from overactive bladder and frequency. It is definitely not covered by insurance. Go figure. Insurances will cover Cialis, but they won't cover Mona Lisa Touch. It's my big gripe. But anyway, it is an in-office procedure similar to a pap test. You do have to undress. It requires 3 short treatments. It's very, very manageable, doable in the office. And I have one of my patients after this treatment went Christmas shopping to tell you that it's quite benign. Requires 3 treatments, 8 weeks apart. There is, and I offer it here in the office. There is, you're welcome to come in for a consultation. There's no obligation. It's a free consultation, and there's never any pressure. I will give it to you. I will, make sure that you're a good candidate for it or not, and see what will work for you. And you never ever have to change your gynecologist. So you can come and get the procedure done. I will send the report to your gynecologist, and then you go about your business, The other one that I have in the office, and this is geared mainly for bladder incontinence, and this is it's FDA cleared, as is the Mona Lisa. Both of them are FDA cleared. Now, one note of caution for the Mona Lisa Touch: I have had people that have gone elsewhere, and they have had similar what they call vaginal rejuvenation procedures. And I would suggest that you do your homework before you go in for those, because they are usually laser machines that are used for facial aesthetic procedures, and they have been converted to be used for the vagina. Mona Lisa Touch is a medical device, and it has been mandated by the FDA that the company that makes Mona Lisa Touch not sell it to anybody but gynecologists. So it's not really a plastic procedure. It's more of a medical procedure, and the long-term effects and the efficacy has withstood the test of time. So I have had a couple of people that have come in having had these other procedures, and they are really unhappy because it has not worked for them. So just saying, before you go in and do any of these procedures, do your due diligence and do your homework. So Emcella is also FDA cleared. It is non-invasive, truly, truly non-invasive, where all you have to do is sit on a chair. I'm not kidding, sit on a chair. And there's no, you sit on it with your fully clothed. It's a series of 6 sessions, 30 minutes each over 3 weeks. So 2 treatments a week for 3 weeks, 3 consecutive weeks. And it's the equivalent of doing 11,000, I kid you not, 11,200 to be exact, Kegel exercises in half an hour. And so this is the effect of strengthening that hammock muscle we talked about earlier and making it not as saggy. 80% improvement. I will tell you though, the sooner one comes in, the better. If you're coming in when you're wearing two attends, then you may not see the same dramatic improvement as when you come in the early stages. And basically that's what it is. It's the Emcella. There's a chair, you sit on that chair, and what this does is it basically, this is the bladder, the pelvic floor muscle we talked about earlier, and look how it's sagging down, and that's what causes the leakage. So this hammock of muscle is weak, and you can do Kegel exercises at home, and that will help, but it won't be as efficacious as 11,000 Kegel exercises at a time. And so it basically, that chair in the center here is a huge big magnet, and this chair basically sends out electromagnetic waves, which is basically MRI waves. So it's not radiation, it's not heat waves, nothing. You basically cannot feel it, the waves, but what it does, it stimulates this pelvic floor muscle and generates those Kegel exercises, and that's how it makes it tighter. So there is the sagging actually becomes better. And this helps to regain the control over the pelvic floor muscles. And this is what you can see where the bladder is low down here. This is the pelvic floor muscle, level of the pelvic floor muscle. You can see how the bladder is hanging down. With this treatment, the bladder muscles, the pelvic floor muscles are lifted up. So there's no probe, there's no insertion of anything, there's no cystoscopy, it's non-ionizing, so it's not like you can only have, not like mammograms or bone densities where you get radiation or CAT scans, and it treats the entire pelvic floor while you are fully clothed. Julie, if you will help me turn on that video. Here is a video that I have with patients talking about it, and that, of course, you know, on YouTube you'll see a lot more of these. You can just go in there and search for them as well. Just search for Emsella.
Are you ready?
Yes, go ahead.
Okay.
Thank you.
Before was it consumed my life.
You start looking when you go places, where's the nearest bathroom? You want to be seated close to the bathroom.
I would go maybe through, like I would get up and I wouldn't make it to the bathroom, so I'd have to change my pajamas. So I'd go through maybe sometimes, you know, 2 or 3 a day.
I would buy 2 pants that looked alike. So if I had an accident at work, I would just go to the bathroom and change into my second pair of pants and nobody would ever know. Sometimes it would take me an hour and a half to get to work and I couldn't make it to the bathroom. And it just got so stressful. I finally went to the bosses, and that was extremely hard to do because they were men. And I told them what I've been practicing just to make it through work to feel normal. And then you kind of go down that road, and then age kicks in, work kicks in, the mother stuff kicks in. You just forget about yourself and you take care of everything else around you. The next thing you know, you're starting to wear a pad.
Then when you wear the pad or whatever, then you have hygiene problems. And so it consumed my life.
To date, I'm very happy with the results that I've got from Insella.
I'm not sure how that it works, but it's a chair. And you sit on it and you find the right spot.
I don't know how to describe it, but it's like this. And it didn't hurt, because if you do this to your hand, it doesn't hurt. I don't know how you would describe that.
It doesn't really hurt or feel good or anything. It's just there.
How does that feel?
Feels great.
It's wonderful. I don't know how it works, but it does.
I don't have dribbles anymore. And when you're out in public, I can make it to the bathroom without dribbles. That's what you want to call it.
And now, as a matter of fact, the only problem I have is I don't think about it. So sometimes I wait too long to think about it. And then I think, but I make it.
For decades, it was since I was 24, I've been dealing with IC. And this is the first falls, you know, just kind of begun that I haven't had an IC flare-up. So I'm very happy on that part.
The Insella has changed my life for the better.
Thank you. So now I have to share my screen.
Yep.
Continue. There we are. Share. All right. So it is for both male and female incontinence. It is also for urine as well as fecal incontinence. Prior to this, for fecal incontinence, we had very few options short of telling people to take Imodium and become constipated. But this is definitely a boon, a godsend. The best thing about it that I see is that we don't have to have them undress, and there are very few contraindications. And again, just like for the Mona Lisa, we do offer the free, no obligation, no pressure consultation in-house, or we even do telehealth if you don't feel comfortable coming to the doctor's office during COVID times. Again, you do not have to change your gynecologist. I will send reports to your doctors so they know that you have underwent this treatment. And one of the good things about EMSLA is that they have different protocols, and they use these different protocols based on how severe or how mild the incontinence is. And the protocol, one of the protocols is also for female sexual dysfunction, where it actually helps improve the intensity of sexual satisfaction, if you know what I mean. And that's another secondary benefit. Just like with the Mona Lisa, the secondary benefit was the help with the incontinence. The secondary benefit with the EMSLA is help with the sexual function as well. But that's not the primary benefit. The primary benefit with the EMSLA is incontinence. So I would suggest, depending on what is the most important issue that you're facing, we can pick one or the other depending on what's a priority. Here's my information. I welcome you all to call to come in and see us, see this EMSLA chair and the Mona Lisa Touch, and see if it's something that would help you. Again, no obligation. Let me know if you have any questions. I would like to open the floor to any questions now.